A subdural hygroma is a subdural body of cerebrospinal fluid, without blood. Most subdural hygromas are believed to be derived from chronic subdural hematomas. It is commonly seen in elderly patients after minor trauma but can be seen in children after an infection. One of the common causes of subdural hygroma is a sudden decrease in pressure by ventricular shunting. This can lead to leakage of CSF into the subdural space, especially in cases with moderate to severe brain atrophy. In these cases, the symptoms such as mild fever, headache, drowsiness and confusion can be seen, which are relieved by draining this subdural fluid. Signs and symptoms: most subdural hygromas are small and clinically insignificant. Larger hygromas may cause secondary localized mass effects on the adjacent brain parenchyma, enough to cause a neurologic deficit or other symptoms. Acute subdural hygromas can be a potential neurosurgical emergency, requiring decompression. Acute hygromas are typically a result of head trauma. They are a relatively common post-traumatic lesion, but can also develop following neurosurgical procedures, and have also been associated with a variety of conditions, including dehydration in the elderly, lymphoma and connective tissue diseases. Diagnosis: in the majority of cases, if there has not been any acute trauma or severe neurologic symptoms, a small subdural hygroma on the head CT scan will be an incidental finding. If there is an associated localized mass effect that may explain the clinical symptoms, or concern for a potential chronic SDH that could rebleed, then an MRI, with or without neurologic consultation, may be useful. It is not uncommon for chronic subdural hematomas on CT reports for scans of the head to be misinterpreted as subdural hygromas, and vice versa. Magnetic resonance imaging should be done to differentiate a chronic SDH from a subdural hygroma, when clinically warranted. Elderly patients with marked cerebral atrophy, and secondary widened subarachnoid CSF spaces, can also cause confusion on CT. To distinguish chronic subdural hygromas from simple brain atrophy and CSF space expansion, a gadolinium-enhanced MRI can be performed. Visualization of cortical veins traversing the collection favors a widened subarachnoid space as seen in brain atrophy, whereas subdural hygromas will displace the cortex and cortical veins. References: Tavares, Juan M. al., eds. Radiology, Diagnosis, Imaging, Intervention 1994 ISBN 0-397-57115-1. Ch. 37, 9-13. Brain INJ 1998 Jul. 12, 7, 595-603. McCloney K.W., Yeakley J.W., Fenstermacher M.J., al. A subdural hygroma versus atrophy on Mr. Brain Scans, the cortical vein sign A. AJNRMJ Neuroradial 1992. 13, 1335 €39.